bacteria that are resistant to antibiotics are more difficult to treat. The usual antibiotics that we use to treat them are ineffective, so we have to resort to using antibiotics that are either less effective or potentially have more harmful side effects. In some rare cases, we completely run out of antibiotics altogether.
So explain how the overuse of antibiotics is making infections harder to treat. I mean, how does one go about, overusing antibiotics if you're trying to battle a disease or something and you're prescribed an antibiotic? I suppose you get that sort of in segments, or you get that treatment little by little. How does one overuse?
Okay. So don't get me wrong, antibiotics are wonder drugs, and when you need them, and they are there to treat infections you have to treat. The difficulty arises when we use antibiotics to try and treat a infection that is, say, a viral infection where the antibiotics have no benefit whatsoever, and then all that will do is provide encourage or provide a selection pressure, it's called, for antibiotics to develop mutations that are resistant to those antibiotics.
Where do we go from here? You talked about how different countries and Gibraltar are tackling it.
Yeah.
Where do we go?
So I think there's not going to be one fix. I think the message we're trying to get across is to keep antibiotics working is everyone's responsibility. It's the responsibility of those who prescribe them and the responsibility of those who take them as well. So there's a number of things that we are doing locally. We have set up a group with lots of different healthcare professionals within the GHA that are involved in various facets. So for one, we've introduced tests that will allow us to diagnose resistant bacteria faster. Tests that look for the DNA of the organism as opposed to trying to grow the bacteria, which is the traditional way of diagnosing the infection. So we're getting the diagnosis quicker. We're trying to identify groups of patients who are at higher risk of antibiotic-resistant infection, and sometimes we have to place these patients in a side room on the hospital or isolate them in order to test them to make sure they're not carrying some resistant organism rather than placing them on an open ward. These are precautions we are taking to safeguard our hospital. We are also looking at using our antibiotics more wisely. So we've developed some guidelines for antibiotic usage for both primary care, general practice, but also for secondary care in the hospital. And those guidelines are evidence-based and actually encourage the use of antibiotics that should not promote resistance developing as much as others. We are also moving forwards in trying to improve awareness and education through using the media, posters, through social media campaigns, and also using different approaches. When you attend to see your GP, you may not get prescribed antibiotics at the outset. You may be given an information leaflet or a delayed prescription for antibiotics, meaning take them only if your symptoms don't get better from your sore throat or earache in 3 days' time, because many common infections are actually viruses and they will respond, they'll get better of their own course without requiring antibiotics. So there's a multifaceted campaign with diagnosis, behaviours of clinicians, and also education for all levels, population, in hospital, pharmacies, every angle we can use.